Robert is demonstrating. Very good. Very good. Oculomotor, it goes to the muscles of the eye, the extrinsic muscles of the eye, which control the direction of the eye. Okay? Now, to touch, TT. Number 4 is known as the trochlear nerve. Number 4. And number 5, which is a fairly large cranial nerve, is known as the trigeminal nerve. Sure.
I'm sorry.
Trigeminal?
Yeah.
Okay. Can you see that?
Yes.
Trigeminal nerve. Okay. The trochlear nerve gets its name because it innervates the superior oblique of the eye. What is the name of that device that the tendon of the superior oblique passes through on its way to inserting on the eyeball? The trochlea. So, cranial nerve number 4 is called the trochlear nerve, and it controls only the superior oblique. The trigeminal is a fairly large nerve, which is providing sensory and motor impulses. Okay? I happen to remember it because it looks very large on the diagram as well. Okay? All right, so we got OOO, to touch. Now we're at and feel, AF. This is number 6, the abducens. The abducens. A brief story on the abducens. It controls one of the eye muscles that leads the eyes to abduct. That's why it's called abducens. To touch and feel. Number 7, the facial nerve. Number 7. Can you see these okay? I'll take that as a yes. To touch and feel, VGV, very green vegetables. This one, and that one. This one is number 8. Very green vegetables. Number 8 is vestibulocochlear. You may remember the vestibular apparatus from lecture on Monday. The vestibular apparatus is the apparatus of equilibrium and balance. Cochlea is the apparatus of hearing. Number 8 is the vestibulocochlear. Number 9 is very green vegetables. We're looking for a G. Glossopharyngeal. Glosso is a fancy word for tongue. Pharyngeal is a fancy word for the swallowing area. This nerve is going to carry sensory and motor impulses back and forth from tongue and pharynx. This one here, then, is my favorite, number 10. Very green vegetables. The second V is called vagus. Now, you didn't ask, but I will spell it to prevent you from embarrassment on a test later on. It's not spelled like Las Vegas, it's spelled vagus. Okay? 2 more, and their orientation doesn't quite fit our pattern, but we'll take a look. This one is number 11. It's a funky looking thing. As a matter of fact, if you recognize the gray matter in the spinal cord, you know that we're in the spinal cord here. And we're seeing some roots of this nerve coming off the spinal cord. In that regard, it's called the spinal accessory or the accessory cranial nerve. That's the A in the AH. Ah. The last one then, number 12, is called hypoglossal. And the hypoglossal is involved with the tongue, okay? Motor inputs, glossal, G-L-O-S-S-A, glossal. So there are your 12. On test, I'll give you a diagram that looks like this. and I'll ask you to identify some of these, okay? If it helps, I tend to ask you to identify the ones I consider important, like vagus and vestibulocochlear, okay? And on our sheep brains, it's very easy to see optic and olfactory. It's some of the other ones that are a little harder to find, okay? So expect one station that has, let's say, 3 or 4 of these that you need to identify, okay? You have questions? Yes?
You said on the sheep brain it's really easy to see the optic and what?
Olfactory nerves, okay? So let's fill in the rest of this then. Where's the pen? Yes, sir?
On the test, when you have us identify them, is it gonna be like a diagram like this?
Yes.
Or you're not gonna ask us to find the vagus nerve on sheep brain?
It would be a feat. Probably doable.
Okay.
Robert, I will ask you to be able to identify the optic and olfactory nerves on a sheep brain because you shouldn't have any trouble. The remainder, I would use this diagram, and it would be pretty straightforward, easy to see.
Okay.
All right, so to fill these in then, we had abducens, okay, and we had facial, and then vestibulocochlear, glossopharyngeal, and I shouldn't do this anymore, and then the vase. The A is accessory or spinal accessory. Both of those terms are totally okay. The reason why it's called spinal accessory is because honestly, its roots come off the spinal cord, not the brain stem. But it then enters the cranium, so it's referred to as a cranial nerve, and then H is hypoglossal. Okay, so for the remainder of the lab, you can work on preparing for your exam that comes up on Monday. You've learned, or you've been introduced to, the cranial nerves. There are a few peripheral nerves on this board that I'll be happy to show you. There's portions of the lab that are dedicated to some of the peripheral nerves. You don't have to learn that many, just a few. And then you can review whatever you want to review. If you want to get started on the eye, I'll be happy to start showing you the eye's anatomy, okay? Otherwise, let's just say the remaining period is to prepare for lab exam, okay? Yes?
What other types of things will be on the lab exam other than the cranial nerve?
Okay.
And the peripheral nerve?
All right. For that, you take a look at your pink sheet, and you can see that we started off with the anatomy of the multipolar neuron.